Well, welcome back. Hopefully you've watched the first video on what's midterm all about. And we sort of alluded to this in that video that medical terminology and the medical terms that we're going to be learning during the course of the semester are really important to understand for lots of different reasons. However, when we make these words, we have a number of various rules. And in this video, we're going to be going over some of these rules as to how a word is made, how a word is broken down, and things like that, various parts of a word. Not all medical terms are made this way, but a large number of medical terms are made where basically we have a center portion of a word, which is called a word root, and then we add a suffix because all word roots have to be finished off with a suffix, and then we may or may not add a prefix, which is at the very beginning of the word. And sometimes we'll talk about how these words are put together. And what this means is that if you actually have an idea about what the word root means, what the suffix means, and if there is a prefix, what the prefix means, you could pretty much come up with a definition of a word without ever having seen the word before. So that's what we're going to talk a little about today, how these words are constructed and how they're really broken down. So that's going to help you out a little bit. So basically, we're going to be talking at this video, rules of medical terminology, word parts, because again, we'll talk about the different parts of a word and how words are formed, and then also how they're broken down, okay? Well, first of all, again, making these words has various rules, and some of these rules we're going to be going over so that'll help you to understand what those rules are, such as when do we add certain things called combining vowels and things like that, and that will sort of give you a good context in regards to how these medical terms are formed. But when we talk about words, okay, let me just go ahead and get this. There are various parts, word parts, like we say, and these word parts allow you to create certain words. Okay, and what I've mentioned thus far is if I understand, what these word parts out, I'm able to understand words by recognizing the basic parts of a word. Okay, and that's what we talk about. Now, what are these parts? I've mentioned them very briefly already before. First of all, we have a word root. And a word root is basically the foundation of that word. If I see a word root cardi, I know it's always heart. If I see the word root gaster, I know it's always stomach. If I see the word root enter, I know it's always going to be intestine, something about the intestine. If I see the word root nephro, I know it's something to do with the kidney. It doesn't know exactly what yet, but I know it has something to do with that. So the word root is basically the central part of the word where the word actually starts. Okay. I'm going to jump down to suffixes next. Okay, and this is a rule that you need to know right now. That if I have a word, okay, and this is rule number one, and we'll probably mention this rule multiple times during the course of this video. If I have a word root, all word roots need to be finished off with a suffix. Let me mention it again. If I have a word root as a central basis of a word, that word root has to be finished off with a suffix. Okay, so a suffix always is going to follow a word root. You can't have basically a word root by itself. There has to be a word root followed by a suffix. Okay, and suffixes are just like we talked about in the English language. Suffix is basically something that's added at the end of a word. Okay. We also have what are called prefixes, and the prefixes are very much like what we talked about, in English language. They're at the beginning of a word. Okay, so we could add them. Now, prefixes are sort of like embellishment. Okay, that what happens is I don't need a prefix on a word, but on the other hand, if I do have it, it makes that word much more specific. Okay, it's sort of like a cake, a birthday cake. Okay, well, if I make that cake, you take the batter, you put it together, you put it up and you make the cake. Basically, that's like looking at a word root. Okay, I have the basis of that cake, but who really wants to eat a cake just by the cake material and nothing else? So basically, I know that cake has to be held together. I have a layered cake. You just can't put one thing on top of the other. It has to be stuck to it. And what do? We add frosting between those layers, okay? And then we add frosting around the top. And that basically is what we call a suffix. So if I have that cake, my word root, I have to finish it off with a suffix, okay, which is the icing. What happens is then, you get a cake, it's your birthday, and they just throw a cake that has a little bit of icing on it, throw it on the table and say, hey, thanks for the cake, but you wish it said, happy birthday, big guy, or something like that, okay? So what happens is, or you want some candles. Now, I don't like candles. I just turned 70, and I really don't want a whole lot of candles on my cake, okay, because it'll probably fry it. So but we want some more embellishment to make it a little bit more exciting, and basically that's what we consider with a prefix. It's sort of like the candles and the writing on the cake, or the little pictures, or whatever the case may be. Okay, so these are the basic components that we have in a word root, or of a word. Word roots, basic center. Suffixes always has to follow a word root, okay? In other words, if I have a word root, I need a suffix. That's a rule. Yeah, it's a rule. And then I may or may not add a prefix to make the word more descriptive, okay? We have what are called combining forms, okay? And combining forms, you'll probably, if you looked at the textbook or anywhere else like that, you'll see that what happens is a lot of times you'll see a word root followed by a slash and an O, and occasionally, not that often, occasionally an I, okay? And basically, these combining forms are basically various combining vowels and elements that make the word root a little bit more complete, okay? And what these combining vowels do is they allow you to connect word roots, prefixes, and suffixes. So a lot of times what happens is when I put a word together, it just doesn't sound right. It doesn't flow off the tongue very well. So we're going to add a vowel in there. Now I'm going to give you rule number 2. Rule number 1, if I have a word root, I have to finish it off with a suffix. I'm going to give you rule number 2. Okay, rule number 2 now. And basically, in most cases, that vowel is going to be an O. Is going to be an O. So if you don't know what vowel to add in there, it's going to be an O. Sometimes it's an I, but most commonly it's going to be an O. Most commonly it's going to be an O. So that's rule number 2. Okay, now let's talk a little bit more about these individually and get those all down so we understand everything that's going on. Again, that word root, like I mentioned, is the main part of a word. It's the foundation of a medical term. It provides the general meaning of the term. I can't say all, but many of the word roots indicate a body system or a body part. Like I said, cardi, heart, gaster, stomach, enteral, intestines. Hepato would be liver. Enteral mean, let's see, nephron means kidney. Sometimes these word roots also may mean an action. We're going to be exposed to a couple of these word roots that might be an action down the road. Now, this is also another rule. Rule number 3 is a word root. Again, not all words, not all medical terms are made like this, but many terms are made like this. What happens is rule number 3: a word may have more than one word root. Like, in other words, if somebody went to a gastroenterologist, gaster, stomach, enter, intestine, ology means the study of, that's a suffix, because again, word roots need to be followed off with a suffix, going back to my rule number 1. Gastroenterologist means the study, or one who studies the stomach and intestines, because I've had 2 word roots, gaster and enter, so both of those are there. So we can have more than one word root in a word. It doesn't have to be limited to one. We could have more than one if we want. We can have one if we want. I mean, maybe we just don't like to be that complicated, but we make the word much more specific by adding more word roots if I want. Okay, let's look at, that's just an example of what we have here. Again, what's we know it's the basic foundation of word or word root. It's all Greek and Latin. Who cares? I mean, I never took Greek and I never took Latin. I mean, I remember when I was in like elementary school, I said, I think I might want to go to medicine. I remember one counselor saying, well, maybe you should take Latin. I never went to high school that taught Latin, and I haven't found it made a difference to me. Because again, when we look at English derivation, a lot of these words have a Latin origin to start out with. It's just a little bit changed from that, okay? So this word root is basically that basic foundation, and it can be changed, that word root can be changed by the meaning of the word by adding various components to the word. Now, let's take a word root and show you what I mean. Let's take the word root glyc. The word glyc means sugar or glucose, So if I see glyc in a word, G-L-Y-C in a word, I know that that has to have something to do with sugar or glucose. So what do I do with this word glyc? Okay, well, rule number 1, if I have a word root, I have to finish it off with a suffix. And what we've done is we've added a suffix, emia, right here, and emia means blood. Okay, so glycemia, I put this word together, glycemia, sugar, blood, or blood sugar. Okay, and actually when we start to talk about how we define words, we actually start with the suffix and then go to the beginning of the word and read from left to right. We'll talk about that as a rule that'll come up later on. So glycemia. So now I've taken glyc, which means sugar, I've had emia, which means blood, and now I have a word that I put together, because again, word roots have to be followed off by a suffix. I have glycemia, which means blood sugar. But what about blood sugar? I could add this word and make it much more specific by doing what? Yep, adding a prefix. So let's add a prefix, hypo. Hypo is a prefix that means low. So as a result, now I've gone from glyc, sugar, to glycemia, meaning blood sugar, to now adding a prefix, hypo, which means low blood sugar. Okay, and blood, low, sugar. If I'd start the suffix and then go to the beginning, blood, low, sugar. Therefore, hypoglycemia means low blood sugar. Okay, so and that word's always going to be consistent. If someone says they have hypoglycemia, I know that their blood sugar levels are low. However, this is the really cool thing. Okay, I'm gonna play a little magic for you. Okay, close your eyes. Close your eyes. Okay, humor me. Close your eyes. I'll tell you when to open them. Keep your eyes closed. What happens? Oh, now I can open them. Oh, what I've done is I've actually changed that prefix. Instead of hypo, now I've changed it to hyper. Wouldn't that pretty nice magic trick, okay? I'm sure I'm not going to get on Penn and Teller or anything like that. But hyper means high. So I've gone from hypoglycemia to hyperglycemia. Why? By changing the prefix on that word, okay? So that's how we can actually manipulate words around. Therefore, you can't miss this up. In other words, if the patient comes in with hypoglycemia, okay, and you say hyperglycemia, then they give them insulin, it lowers the blood sugar more, and that's bad. They die. So in other words, hyper means high, hypo means low. Glycemia just means blood sugar, but I could make that blood sugar word a little bit more specific by adding a prefix, hyper and hypo. And that's how we put words together. Where did it start? It started with the word root, and my word root was glyc, sugar. Okay. Again, I should have changed this. Okay, I'm going to do. Let me just. Sorry, humor me for a second. I changed out all, okay, because that's really not always true. I know the medical terms will say, medical term text will sometimes say that, but it says all medical terms with at least one root. No, some words are made special and they don't really have any of this formation, but again, many of these words do. But we have a lot of these words have at least one word root. And again, some words have multiple word roots, like I said before, which is one of my other rules that we talked about before. Let's take an example. If I see the word root dermato means skin, okay? So what about the dermato, okay? I know that if I have a word root, I need to finish it off with a suffix, okay? That's the rule number one. I need to follow a word root with a suffix. Logi is a suffix that means the study of something. So dermatology would basically be the study of skin. Piece of cake. That's easy. Okay. Again, when we define it, we'll talk about this later. We start with the suffix, then go to the beginning of the word and read from left to right. We'll talk about that later as a rule a little bit later. So dermatology means the study of the skin, but I could change that word because again, I might be able to have more than one word root. Let's change the suffix. Again, I could change the suffix. Dermatologist, logist is not just the study of something, but one who studies. So now I have one who studies the skin, such as a physician who is involved with skin diseases called a dermatologist. Piece of cake. Oh, something happened here. Patho, patho is another word root. And patho means disease. If I look at patho, it means disease. Okay, disease. And so I have logist, again, which means one who studies skin diseases. One who studies skin diseases. So I've actually, in this word, I have two word roots. I have word root number one in dermato, word root number two in patho, which is basically disease, and basically skin diseases, one who studies skin diseases. So again, I could have more than one word root in a word, and that's not a problem, okay? So that's in fact, that's not uncommon at all. Couple other things I should mention about word roots is they always keep their same meaning, okay? There are a couple word roots that might have a couple meanings to it, but that's not usually the case. Okay, most times the word root will actually have one specific meaning and stays with that. Okay, and again, like we've shown already before, in a couple of these slides, is prefixes and or suffixes will change the meaning of the word. Again, if I have a word root, rule number one says I have to have a suffix. I don't necessarily need a prefix; it's not always there, but I do need a suffix. And what happens is by adding either more word roots and then always a suffix and then sometimes a prefix, it causes an increased meaning of the word root. It makes the word much more descriptive. The more I add to it, It's nice. You go out and buy a car, and what happens is you could buy a very stripped down car. I remember my son bought a car a couple years ago, or probably about 5 years ago now. And basically, he was a teacher, he doesn't make any money and stuff like that. He bought a car, and people are wondering, you're still rolling down your windows? You don't have electric windows? And he says, yeah, I had the stripped down model, and stuff like that. But what happens is now, I mean, next car he's going to buy, he's still riding this thing into the ground. Next car he's going to buy, he's probably going to have a lot more bells and whistles on it. Okay, so it's just like adding more parts to this term. The more I add to it, the more the word becomes embellished, the more precise that definition becomes. Okay, and again, the descriptive terms are increased by adding suffixes and prefixes like we've shown already. Okay, now these are some common word roots, and when you look at this list, it's very small. As we go through the semester, when I get into each body system part, stuff like that, I'll be giving you more and more word roots, and by the time the semester's done, you're going to know a lot of word roots. Okay, but just a few of these. Adno means gland. Adno. When people have like you have a sore throat and the doctor says, oh, you got swollen glands. Okay, basically that's called adenopathy. Pathy could be a word root, but also could be a suffix as well. So adenopathy would be a disease of the glands, because what happens is the bacteria or the virus that's in the tonsils drain. And what happens is the body sort of like absorbs them, or sort of sequesters them, and it's taken to lymph nodes where a lot of that stuff is destroyed. Therefore, the lymph nodes become swollen, enlarged, and inflamed, and that's called adenopathy. So adeno means gland. Carcino means cancer. One of the more common type of cancers that we get of the colon is called adenocarcinoma. Oma means tumor, adeno means gland, carcino means cancer as word roots, and these are basically some certain glandular areas of the colon and that become malignant or become cancerous. Okay, I mentioned before cardo means heart. Okay, chemo means chemical. Chemotherapy. Therapy would be a suffix. Okay, and chemo means using chemicals as a form of treatment. Okay, sizo means to cut. We talked about dermato means skin. I mentioned before entero means small intestine. Enteritis. Itis is a suffix that means inflammation, and enteritis would be an inflammation of the small intestine. I mentioned gastritis would be an inflammation of the stomach. So gyneco means female. Gynecology, the study of female or woman-related problems. Okay, hemato means blood. Hematologist would be someone who is involved with blood diseases or blood, or hematopathologist, blood diseases. So hemato. One that's very close to that I don't have listed here, I'm going to write it here, would be hepato. Hepato means liver. So hemato and hepato, a lot of people switch those two words up. But if you remember hepatitis we know is an inflammation of the liver, so it's easy to see hepato means liver. A couple other word roots that we should talk about. Hydro means water. Okay, hydrotherapy. Hydrotherapy is like a whirlpool, so they're using water as a form of therapy. Immuno means immune. That doesn't take a rocket scientist to figure that one out. Immunology, the study of immune responses in the body. Laryngo means voice box. Let's go to the itis again as a suffix. Laryngitis would be an inflammation of the area of the voice box. That's why you get hoarse, because the vocal cords become inflamed and irritated. Morpho means shape. Neuro means nerve. Okay, neuropathy. People with diabetes, they frequently get a numbness that's in their feet. It works up the leg. It's called a stocking glove numbness, or a neuropathy. And basically, pathy means disease. Okay, which could be both a word root, but in this case, it would be a suffix. So neuropathy would be a disease of the nerve that's associated with diabetes. Ophthalmo would be eye, ophthalmologist. Okay, odo means ear. When they look in your ear, they use something called an otoscope. Scope would be a suffix. Odo means ear. Again, we talked about patho means disease. Pulmono means lung. you know, and uro means urine or urinary tract. So these are some common word roots, but again, we're going to be getting to a lot of word roots as the semester goes on. Some people like to use flashcards to be able to try to remember these. I was never really a big flashcard person myself, but that doesn't mean you aren't, you know. And if you like flashcards, that's perfectly fine. Okay. Now, excuse me. Now, I mentioned sometimes if you look at if you look at the textbook, okay, if you look at the stuff in medical terminology, what you'll see frequently written is like gas with slash O. Okay, now this area right here, this O, means that sometimes I need to add an O as a type of glue to hold words together, and this is called a combining vowel. This is called a combining vowel, this little O right here. Again, most of the time, like I mentioned in the rule before, most of the time it's O. Sometimes it might be an I, but most of the time it's no. It's usually an O, but sometimes an I. And basically, it's used to join words together. Now, there's some words, some rules, and I have my rule, which I think is important, just as important as some of the other rules. Because again, people like have rules, and sometimes there's too many rules, and it's hard to remember all the rules. My rule is, how's it sound? If it sounds good, use it. If it doesn't sound good, throw it away. You know, like if you stick some food in the refrigerator and you forgot that it was there, and you go in a couple days and say, should I eat it? What do? You do a sniff test. If it smells okay, then fine, go ahead and eat it. If it doesn't smell, you throw it in the garbage. Okay. If it sounds good here with these combining vowels, use it. If it doesn't sound fine, probably throw it away. Okay. And these combining vowels are used to join words together. Okay. And what it does, it really makes pronunciation easier. And again, like I mentioned, there are some rules to live by. Okay, there are some rules to live by, and I'll mention these rules. But again, the most important rule, I think, in my mind, is how's it sound. Just think about it. Just say it and see how it sounds. Let's talk about some of those. Okay. Okay. Let's look at this word hemat. Hemat is a word root that means, like we talked about, means blood. Okay. Let me see if I can. Okay, let me see if I can decrease myself there so it might come up in the way. So hemat means blood. Okay, now I have a word root. What does this mean? I always have to have a suffix. So let's add a suffix. Okay, logi. Logi, like I mentioned, is a suffix that means the study of something. So here's what I want you to do. Okay, I want you to take that word and I want you to just pronounce it to yourself. Okay, does that sound right? Doesn't sound right to me. Hematology, something is wrong. Hematology, what do you think I need? I think I need a combining vowel. So I'm going to move the logi over to the side. I'm going to add that combining vowel, which again, in most cases, an O, and I'm going to bring it back. Hematology. Wow, that sounds good. I'd probably even name a child hematology. I mean, that sounds so good, you know. It's a nice word. So hematology is right. Why we've added that combining vowel in there as an O, because it makes the word sound a little bit better. And sometimes we'll find that if I have one consonant here and a consonant here, I have to separate those two consonants by a mediator, and then mediator is frequently going to be O. Okay, so that's just one example. Let's look at another. So now again, what I should mention too is you're going to hear this time and time again. Something called a combining form. Okay, and a combining form is basically a word root plus a combining vowel. So a word root. Okay, so if I take a word root plus a combining vowel, basically that makes a combining form. Okay, so word root plus a combining vowel. If I looked here, I'd have that slash like in the textbook, but we take that slash out when we actually write the word. Okay, so basically that's what we call a combining form, is that word root plus the combining vowel. Okay, in this case, I needed it. Let's go some rules and just talk about these rules. Generally, when using more than one word root, a combining vowel is needed to separate different word roots, regardless of whether the second or third word root begins with a vowel. Okay, there's some exceptions to all these rules. Okay, let's look at the example. Gaster, we mentioned gaster means stomach. Okay, so that's one word root. Let's add another word root. Enter, we know enter means intestine. Okay, and then we know that we have to have a suffix because all word roots need to be completed off with a suffix. Scopy. Scopy means to look at it with a scope. You know, that's where they actually take a tube and put it down there to be able to see things. So gastroenteroscopy. That's just say the word as it is, like it is now. Gastroenteroscopy. Does that sound right? I don't know. I'm getting itchy. I'm starting to break out in hives. It doesn't sound right to me. So basically, I'm going to change that. How do I change that? Let's add a combining vowel there. Even though that this second word root started with an E, which is a vowel, a gastro-enter, that sounds better. Gastro-enter, and then now I have two consonants here, so I'm probably going to add a vowel, and again, that combining vowel is going to be an O. So back gastroenteroscopy. Now that's a nice word that just rolls off the tip of the tongue. Sounds good, smooth as butter. So as a result, gastroenteroscopy is correct in this situation. Okay. Second rule, a word cannot end with a combining form. In other words, a suffix is always added at the end of the word. A combining vowel will be used if the suffix begins with a consonant. A combining vowel is generally not used if the suffix begins with a vowel. Okay, and that's when we're talking about finishing off a word root with a suffix, because we know from rule number 1 earlier, all word roots need to be finished off with a suffix. So let's look what we're talking about. Let's take gastro again, and let's take enter, and we know we have to add that O in there. Gastro enter, okay, that's part of it. Let's add a suffix, because I know I can't, this is a word root, this is a word root right here, I need a suffix. Let's add a suffix. Ostomy, okay. Ostomy is making a surgical opening. Okay, gastroenterostomy. Now, ostomy is a suffix that begins with a vowel, so I don't need to add another combining vowel. So this is the suffix as it is right here, so I don't need to add another combining vowel. So because it begins with a vowel, I don't need gastroenteroostomy. You know, that just doesn't sound right. Gastroenteroostomy, that just doesn't sound right. Okay, so gastroenterostomy is perfectly fine. Okay, and that's the way you'd put it in there. Okay, let's talk about some other parts of a word. Let's talk a little bit more about a suffix. Okay, a suffix is that word element that's attached at the end of the word. So it's at the end of a word root. Okay, and again, if I have, sometimes it's funny, and again, this is one of the things that we sometimes see is sometimes we have a prefix and suffix without a word root. That's fine. Okay, that would be a possible way of making a word down the road. A limited number of words are just a prefix and a suffix. But again, going back to my rule number 1, if I have a word root always has to be followed off by a suffix. Okay, and that suffix makes that word root much more specific, like we saw before with the glycemia. It will change the meaning of the word by giving it more precise definition. It makes the word much more descriptive. Okay, all medical words have an ending or suffix unless the word, the root is a word itself. Sometimes we have some words that are made that are just special words, and they really don't follow any of these rules. But that's not what we're talking about in this class. Forget about them. Get rid of those things. Okay. Let's look at the word Arthur, the word root Arthur. The word root Arthur means joint. Okay, so if I look, see Arthur, Arthur means joint. Whoops, I'm not writing here. Joint. Okay, means joint. Okay, so Arthur means joint. So I know the word that I have here has to do something with joint. Okay, but what does it have to do with joint? Okay, what does it have to do? Let's add it. So I know if I have a word root, I have to add a what? I have to add a suffix. It has to have it. That's a rule. Now, alga is a word that means pain. Okay, now the alga begins with a vowel. So basically, let's just pronounce that word. Okay, just say it to yourself before I go on. Arthralgia. It sounds good to me. Which sounds better, arthralgia or arthralgia? I think arthralgia sounds a lot better. It's much smoother, much more easy to say. Okay, so do I need a combining vowel here? No, I don't. So arthralgia is a great word, meaning joint pain. Piece of cake, easy. Now I could change this here. Okay, I could change this itis. Itis is a word root that means inflammation. So arthritis. Which sounds better, arthritis or arthritis? Arthritis sounds good because I don't need a combining vowel. Why don't I need a combining vowel? Because my suffix begins with a vowel. So I usually don't need to add a combining vowel in that situation. So arthritis is a great word. Okay, you hear it all the time. I'm sure that everybody here is listening to this video has probably heard arthritis already. Osis. Osis is a suffix that means condition. So arthrosis means a joint condition. Which sounds better, arthrosis or arthroosis? Arthrosis sounds a lot better. I don't need a combining vowel. Why? Because the suffix begins with the vowel itself. Piece of cake. Easy. Some rules. If the suffix begins with a vowel, the root will attach directly to it. If the suffix, however, begins with a consonant, the root will need a combining vowel before attaching to the suffix. Okay, that's pretty much what we talked about in our preceding slide. Let's take Arthur again. Let's take Arthur again. We know it means joint. Okay, pathy. Arthropathy. Okay, that just does not sound good. Why? Because pathy begins with a consonant. So what do you think I need? Of course, even if you were sleeping for the first 20 minutes, you realize arthropathy means doesn't sound good. So I need to add a combining vowel. So what do? Let's move the pathy over and let's add an O, arthropathy. Arthropathy just means a joint disease. All types of arthritis, arthritides are arthropathies. So basically, it's good. Arthropathy sounds good. Why? Because the pathy started with a consonant. Therefore, I need a combining vowel. Now, these are some some common suffixes. Again, this is actually a very, 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 very brief list of the suffixes. Okay, alga we talked about means pain, means pain. Size means to cut. It's interesting. You hear someone that incise something, incise. Incise, in would be a prefix, size is a suffix, so that's a word that there's no word root in, so that's a good word, okay? So that size means to cut. Dynia also means pain. So if I said arthralgia, would be joint pain. Arthrodynia, and you notice I added a combining vowel. Arthrodynia means joint pain as well. I've already heard that. I've always heard arthralgia as the common word and stuff like that. Ectasis means dilation. So when things could, arterioectasis, something where the vein or the artery would be more dilated. That's not a common word, I think. Genic means producing. There's a type of a cancer called an osteogenic sarcoma. OSTE/O means bone. And I could say osteogenic because what happens is osteogenic sarcoma actually is a bone tumor that actually causes a tumor that you see in bone where the bone gets changed, where bone is produced. So genic means producing, okay? IA, that's pretty boring, means state or condition. IASS, abnormal condition. ISM, a state of, all these are sort of boring. I'm sleeping already. Logis, we talked about one who studies. Lysis, okay? Means the destruction. Hemolysis would be the destruction of blood. Hem/O means blood, okay? Hemato or hem/O both mean blood. Hemolysis would be destruction. Now, when you're giving blood, they type your blood because they try to match your type, or they have to match your type of blood of a donor with a recipient. If not, it causes a reaction. It causes hemolysis, where the blood cells will start to, the immune system sort of destroys those blood cells. So lysis means destruction. Malacia means softening. Osteomalacia would be softening of bone. OSTE/O, which is the combining form. Osteomalacia means softening of bone. Megaly means enlargement. Cardiomegaly would be enlargement of the heart, because cardi as a word root means heart. Oma, like I mentioned, means tumor. Okay, very, very commonly used word. Lipoma. Lip, L-I-P, means fat. That's easy to remember, like liposuction, suction, where they suck away fat. So lipoma would be a fatty tumor. Osis, I mentioned before, is an abnormal condition. Pathy, we talked about, as a disease. Plasia means growth or development. When something is excessive growth or development, it's called hyperplasia, where that's another word where we actually have a prefix hyper and plasia, a suffix without a word root. Okay, but plasia means the growth or development. Plasm also means formation. Ptosis means drooping. Okay, and that'll come up later on in the year. Ptosis means drooping. Rage means excessive or abnormal flow. What's the excessive or abnormal flow of blood? Hemorrhage. Hemo, again, Hem/O or hemato, but in this case, HEMO. Hemorrhage means excessive flow of, or loss, or discharge of blood. Rhea also means a discharge of flow. Rhinorrhea. Ooh, what's that mean? Rhinorrhea. Rhino is a word root that means nose. So therefore, rhinorrhea is runny nose. Okay, rhea is a discharge or flow. Rhexis means rupture. That doesn't come up all that often. Sclerosis, hardening. Okay, arteriosclerosis means that what happens is the hardening of the arteries, because artery slash o is a word root that means artery. Okay, so arteriosclerosis would be hardening of an artery. Stenosis would be narrowing, means narrowing of something. Okay, uh, so sometimes stenosis could be used as a word very commonly by itself. Okay, it's just a specific word. Like sometimes valvular disease, they have what's called aortic stenosis, where one of the valves is narrowed. Okay, in leaving the heart, which causes some problems. Okay, so stenosis means narrowing. Therapy again means treatment. Hydrotherapy, treatment with water. Trophy is nourishment or development. Hypertrophy would be excessive nourishment or development, and uria would be a condition of the urine, such as you'd feel this one. Let's say a word. Hematuria. What do you think hematuria would be? Well, hemato means blood, and urea means urine. That means blood in the urine. See how simple this is? I mean, we're done. Okay, semester, class over. No, it's not like that. Okay, because we have a lot more to talk about. But this is very simply how things are. Okay, and these are some common. Now we have what are called adjective suffix. Okay, now when we look at a word, most of these words are going to be nouns or adjectives. Okay, noun is what? Name. It's a name, person, place, or thing. Okay. Adjective suffixes are different. Adjectives are things that describe a noun. I gotta change my pen. Describe a noun. Okay, and again, most of these mean pertaining to. Okay, and this is a whole long list, and these are probably, you say, oh my gosh, I'm gonna have to remember that. ACALANARYICALIC, all these, and I actually added the word after it. Okay, so these are called adjective suffixes. If I have a word root and I want to make it a descriptive word which would describe a noun, I'd add one of these suffixes. Let me take an example here. Let's take the AC. Okay, AC. Cardiac. Cardiac catheterization. Cardiac catheterization is where they take a tube and stick it up, usually the femoral artery, stick it up to the aorta, and it goes into the heart. Okay, and they take this tube and they could put dye in there and see where the blood's flowing and see where the arteries are open and stuff like that. Well, the noun here would be catheterization because that's the name of a procedure. But what type of catheterization is it? It's a cardiac. Therefore, the cardiac is a descriptive word that describes the procedure. Therefore, that makes that an adjective. Okay. Next one, duodenal. Now, the duodenum is the first portion of the small intestine. We'll talk about that in the GI section. And somebody may have a duodenal ulcer. What's the noun? The ulcer would be the noun. That's the name of the lesion, or that's the name of the sore that's in the duodenum. But what type of sore or what type of ulcer it is? It's a duodenal because it describes a noun. It becomes an adjective. Ovarian cyst. What's the noun in ovarian cyst? Cyst is the noun. That's the name of the tumor. Okay, but what type of tumor is it? It's ovarian. Okay, so therefore it pertains to the ovary, a cyst pertaining to the ovary. Okay, so basically these are called adjective suffixes, and these are all important suffixes, and you'll see these multiple times during the course of the year. Again, if you have an adjective suffix, what should follow that? Some type of a noun. Okay, so if you look at a noun after the suffix, after the adjective suffix, and it makes a difference. Okay, a gastric ulcer. Okay, neurological disease. Disease would be the noun. Neurological would be the describing the type of disease. Okay, stuff like that. And they have something called an acoustic neuroma. Acoustic neuroma. The noun would be the neuroma because it's a type of a tumor. OMA means tumor, as we talked about before. What type of a tumor? Acoustic means it's involving hearing. Okay, so these are called adjective suffixes, and they're very common. You'll see a lot of these adjective suffixes. We have a bunch of surgical suffixes. Centesis. Centesis means a surgical puncture to withdraw fluid, such as an arthrocentesis. Now we talked about arthro. Arthur means joint. O is the combining vowel. Arthrocentesis is when they take a needle and stick in the joint to suck out the fluid. Okay, so that's a surgical suffix. Ectomy, removal of something. Gastrectomy, gaster means stomach. Ectomy, because now the ectomy begins, the suffix begins with a vowel. I don't need a combining vowel. Gastrectomy, removal of the stomach. Colostomy, making a surgical open to the colon, because colo is a word root that means colon. Otomy, cutting into. Thoracotomy. Thoraco means chest. So thoracotomy, so I don't need the otomy right here is basically the suffix. Otomy would be the suffix, so therefore I don't need a combining vowel. Thoracotomy, nope, thoracotomy would be fine. That's cutting into the chest. Pexy, nephropexy. Nephr means kidney. Pexy, here's the combining vowel, is the O right there. Pexy means a surgical fixation. In other words, they try to tie the kidney up to where it's supposed to be. Plasty, a surgical repair. Rhinoplasty. Rhino means RHIN/O means nose. So rhinoplasty, nose job. Okay. Raphy, suturing. Myopathy. Myo means muscle. Okay, and basically if a muscle's torn, they sew it together, and it's called a myopathy. Okay, herniorrhaphy is basically suturing together a hernia or an opening or a weakness in like the abdominal wall. Okay, so basically these are some surgical suffixes. Procedural suffixes, these are pretty boring. Gram, electrocardiogram means a record or picture. Graph is the instrument to record. You take an electrocardiogram with electrocardiograph, and graphy means the process of recording. So in electrocardiography, you take an electrocardiogram with an electrocardiograph. And again, gram, graphy, they're all have to do with procedures. Same thing like with meter and metry. Okay. Metry means the process of measuring, and meter is a instrument for recording. Audiometry. So audiometry is performed by using an audiometer, which is the machine, okay, or the instrument. And same thing with scope and scopy. You do arthroscopy, okay, process of viewing, with an arthroscope or the instrument for viewing. Okay, so these make a lot of sense, but they're pretty boring. Now, we've talked about word roots, we've talked about suffixes, we have one more thing to talk about, and that's a prefix. And a prefix is an element that's added at the beginning of a word, okay? Now, again, do I need a prefix? The answer to that is definitely no. But a prefix really sometimes makes that word much more specific. It embellishes that word a lot. It does change the meaning of the word by making it much more descriptive than what we started with. Again, it's not a part of all medical terms because a word root does not need a prefix. It's added on if it makes the word better, okay? But it does provide a more definitive description of the word, and that's the nice thing about a prefix, okay? And there's lots of prefixes, and I'll show you some of that. We're going to be doing individual videos in regards to suffixes, a little bit more descriptive about suffixes, and a little bit more descriptive about prefixes, okay? Rule, prefix, because it's a prefix, means it's attached directly to the beginning of a word. You know, we know that in English language. Something actually pre is actually a prefix, you know, but prefixes are added directly to the beginning of a word. Okay, let's take an example. Cardi. You know, cardi means heart. Okay, CARD/I would be the combining vowel. So cardi has something to do with the heart. So I know I have something to do with the heart in this situation. And again, because I need a word root, always has to be followed by a suffix, itis. Now I've eliminated that combining vowel because itis as a suffix begins with a vowel itself, so I don't need carditis. I don't need that. So carditis is a good word. But what type of carditis? I know I have something that means inflammation of the heart, because itis we talked about before means inflammation, and cardi means heart. So something with the inflammation of the heart. What does it have to do with that? We have so I add a prefix. Peri. Peri is a prefix that means around. Around the heart there's a sac. It's called the pericardium. And what happens is sometimes that sac becomes inflamed, and that would be called a pericarditis. Pericarditis. So peri is a prefix that means around. Okay, around. Like perimeter. Perimeter is something that's around. So that's easy to remember peri by perimeter, something that's around. So peri means around. I could change that. Endo. Endo means within. People, when they have like strep throat, one of the things that happens is this: if they don't take the antibiotics to kill the strep, they don't take it for the full course of that antibiotics, the strep remains in the body. And where does it like to go? It likes to go to the inside lining of the heart. The inside lining of the heart is a membrane on the inside of it, sort of like If you look at the heart, it's like a milky colored membrane. It's sort of like I can't say it's white, but it's sort of shiny and smooth to allow blood to flow evenly. And what happens is the strep infection likes this inside tissue, and what happens, it embeds itself in the endocardium, and it causes what's called an endocarditis, which in the past used to be fatal, but now since we have so many antibiotics, we can usually treat it, but usually takes a hospitalization, IV antibiotics and stuff like that. So endo means within. So now I've gone from pericarditis outside the heart to endocarditis within the heart. Okay. Epi. Epi means upon. Okay. Epi is a word that means upon. So sometimes where that pericarditis is, the inside lining that attaches right to the surface of the heart is called the epicardium. So if that's inflamed, that would be called an epicarditis. So I've changed this word 3 ways from peri to endo to epi just by changing the prefixes. And all 3 words mean distinctly different things by changing the prefix. Okay. Now prefixes could come in a number of different colors, shapes, sizes, all kinds of different things. And basically they may depict a direction or location, a volume or number, or sometimes comparison. And this is just some large categories. We'll have other prefixes that we could talk about with that. Let's talk about direction and location. Orbital. Orbital means the orbit is the eye socket, the area around the eye socket, okay? And what happens is the word root plus right here, al, is an adjective suffix, means pertaining. So orbit is the word root, al is the adjective suffix, meaning pertaining to. So pertaining to the orbit, but what about pertaining to the orbit? Okay, let's look at that. Retro. Retro means behind. Means behind. So if something is retroorbital, it means something that's behind the eye. If you ever notice people with a hyperthyroidism, sometimes they have these eyes that look like they bulge out. It's called exophthalmos, okay? And what happens is they have a lot of deposits of material retroorbitally, behind the eye, okay? So retro means behind the eye, okay? Behind the arbor of the eye. Supra means above. If you look at it, you feel this ridge above the eye, that's called the supraorbital ridge. Again, because al is an adjective suffix. Ridge would be the noun, okay? But what happens is supra means above, pertaining to above the orbit, the ridge pertaining to above the orbit. Okay, ridge being the noun, supraorbital being above, because supra means above, okay, or on top of. Infra, if you feel right here in the bottom, you feel a very sharp edge of bone, and that's the infraorbital ridge or infraorbital margin, because infra means below. Means below. So I've gone from retro, behind, to above, supra, to below, infra, and I could even make that even worse. Pre means in front. Something that would be preorbital would be something in front of the eye. In front of the eye, because pre means in front of, before. Okay, we could also have a prefix that means a volume or number. Okay, if I look at here, plegic. Plegic, IC again is an adjective suffix. Plege means paralysis. Paralysis. Okay, so paralysis, pertaining to paralysis. But what type, pertaining to what in regards to paralysis? Mono. Mono is a prefix that means one. So if somebody had one paralyzed limb, they'd be called monoplegic. Monoplegic. Okay, monoplegic. Bi means two. So if somebody has 2 limbs that are paralyzed, it would be called biplegic. Again, because now I've gone from 1 to 2 by changing the prefix. Di. Ooh, this is a tough one. Bi. Guess what? It also means 2. So if somebody's diplegic, it means 2 as well. Bi and di, they both mean 2. I don't know why somebody did that. I don't know. Maybe somebody wanted to have their own little word in there, and they decided I'll say di as well. Quadra. Quadra means 4. So if someone was quadriplegic, it means that they have 4 limbs that are paralyzed. Because quadra, like quad we know means 4. Quadra means 4. And again, here we have a prefix that ends in a vowel, so I don't need a combining vowel. Hemi. Hemi means half. Means half. So a person who is paralyzed in half their body would be called hemiplegic. Okay, hemiplegic. So basically, so we've gone from mono 1 to di and bi, which means 2, to quadra, which means 4, to hemi, which means half. So basically we've just changed the prefix, and I've changed that word multiple different ways. Okay. We could also use a prefix in regards to comparisons, how to compare things. Okay, PNEA. PNEA is a word that means breathing, and breathing. What can I do with this? Eupnia. Eu is a prefix that means good. So as you're sitting there watching this, unless you're getting hyper, unless you're starting to hyperventilate or something like that, basically you have eupnia. Normal, easy, comfortable, happy breathing. So eu means good, normal, happy, comfortable, whatever the case may be. So eupnia would be good. Okay. Dis. Dis is a really common prefix, and this dis means bad, difficult, or painful. So if somebody has dyspnea, what does it mean? They're having difficulty breathing. Difficulty breathing. So dis, I've gone from eu means normal, easy, comfortable breathing to dis, which means bad, difficult, sometimes even painful breathing. Okay, I've changed that word like 180 degrees just by changing the prefix, which is actually one of the cool things we find with medical terminology. Hyper. Hyper means deep or excessive. So if somebody's breathing deeply, it's called hyperpnea. Hyperpnea. Real deep breaths would be called hyperpnea. The thing you don't want to listen when you're, at 3 o'clock in the morning, you pick up your phone, the phone rings, and somebody's deep breathing on the other side. You hang up and call the police. Okay. But anyway, now hyperpnea would be heavy or deep breathing. So I've gone from normal to bad, difficult, painful to deep breathing to tachy. Tachy means fast. Is a prefix that means fast. Tachypnea, rapid breathing. If I was gone from good to bad to deep to rapid, okay? Easy. I mean, just by changing a prefix, done a little magic there. Oop, this is one that you don't want to see. A, short word, means without. Means without. Okay, so apnea would be without breathing. You've probably heard of sleep apnea. And sleep apnea, what happens is people, probably neurological as well, the shape of the oral airway and stuff like that, and the laryngeal, the airway and going down towards the trachea, might be a shape of that as well as neurological influence. What happens is people go long periods of time when they're sleeping where they don't really breathe. If you know something about sleep apnea, it's sort of like you hate to sleep in the same room with them. That's why William Shatner. You don't know this, but I've been using a breathing machine since. Come on, give me a break, William Shatner. I mean, Captain Kirk. What happens is these people, what they do is they go for a period of time where they don't breathe, and all of a sudden, the body says, "Hey, you know what? I need a little bit of oxygen." It creates snore, and what happens is they wake everybody up, and the windows break, and all kinds of stuff like that. So basically, apnea would be without breathing. Without breathing. So I've gone from good to bad to deep to fast to without breathing. Okay, but just by changing the prefix, I've gone from good to bad and really no breathing at all. From just by changing the prefix. Okay, now these are some prefixes that we have. Again, we'll be going over all these prefixes a little bit later. Again, a means without, away from, or something like that. And same thing, and means that. So both a and both mean without. Ante means before. Like when you go into a building, sometimes you go into what's called the ante room, okay, or ante chamber, which is like before the main room, okay. So that would be ante. If you look at the upper portion of the arm, we'll talk about this when we talk about body system or body regional names. This part of the arm up in here is called the brachium. The part in the forearm, which is before the brachium, is called the antebrachium because it's before the brachium. Anti means against. Antibiotic. Biosis means something that's alive, like bacteria. So you take an antibiotic against something that's alive, which is the bacteria. Anti, it's against. Okay. Antibodies are things that the body makes against certain types of things called antigens. Okay. Auto means self. Okay, people have diseases. You'll see this a lot of times now called autoimmune disease. Diabetes is an autoimmune disease. Rheumatoid arthritis is an autoimmune disease. Crohn's disease is an autoimmune disease. And what happens is they create an immune response abnormally against their own body tissues, and that's what this auto means. So auto means self. Brady means slow. When somebody's heart rate is slow, it's called a bradycardia or a slow heart. Okay, we talked about dis being bad, difficult, or painful. Dysuria. Now, uria we talked about before as a word root meaning urine. Okay, as well as a suffix. Okay, dysuria means difficult or painful urination. Endo we mentioned about being within. When they actually look down your throat and down the esophagus or up the south end, okay, doing a colonoscopy, basically those are called endoscopy. Scopy means to view with a scope. Endo means to view within. Okay. Epi means upon. Okay. The outside layer of the skin is called the epidermis. Derm means skin. We talked about that before. And the epidermis is that outer layer or the upon the layer of the skin. We talked about being good or normal. Hetero means different. Heterosexual, different sexes. Homo, okay, means the same. Things that are of the same material are called homogeneous. Genus means formation. That was a suffix that we had before. Homogeneous means that they're the same material. So what happens if you look at like the inside of a tumor? Sometimes the inside of a tumor is the same type of material. Be called homogeneous. Okay. Hydro means water. That's something we had. Hydrotherapy. You know, whirlpool. Hyper, we talked about above, over, or excessive. Hypo, below, under. We talked about that, as well as infra. Infra means below or under, okay, or beneath. Okay, we talked about those before. Intra means within. Okay, intra means within. You've probably all mentioned this before. How about intravenous? If I have an IV means intravenous. Where is it? Inside or within a vein. Okay. Macro means large. One of the things we see in Down syndrome is kids with Down syndrome, or people with Down syndrome, not just kids, but people with Down syndrome, have very large tongue. The word root for a tongue is glosso. Say they have a macroglossia, or very large tongue that fills the oral cavity, very physical characteristic that we frequently see. Micro means small. What do you look at small things through? A microscope, a viewing object to look at small things. So micro means small. Neo means new. Sometimes a new tumor, or a tumor, is called a neoplasm, or a new growth, or new development. So neo means new. Pan means all, Sometimes when people have a problem with their bone marrow, which makes blood cells, they get what's called pancytopenia. Penia would be a suffix that we'll get to later on. We talk about suffix, means deficiency or decrease. Pan means all, and cyto means cell. All the cells that are produced by the bone marrow are decreased. Para means beyond, near, or beside. Paranormal, something's a little bit beyond what's the normal. Okay. Per means through. Okay. And peri means around, like the perimeter. Post means after. Postoperative, after surgery. Postpartum, after delivery. Okay. Postprandial, after meals. Okay. And pre would be the same. Preoperative, before surgery. So post means after, pre means before. Pseudo means false. Okay. Sometimes they have what's called a pseudo tumor. Okay. And basically it's a false type of a tumor. Pseudocyesis, false pregnancy. Cyesis is a word that means pregnancy. We'll talk about that at the very end of the year. Pseudocyesis would be false pregnancy. So pseudo means false. Retro means behind or backwards. Okay, something that's behind, like retroorbital. We talked about. Sub means under or below. It's easy to remember. What goes below the water? A submarine. Okay, the area below the ribs is called the subcostal region. Sub means below or under. Super means above or excess. We talked about, as well as supra. Supra, they both mean above or excess. Tachy, we talked about, it means fast. Where we had bradycardia means slow heart rate. What would be fast heart rate? Tachycardia. Trans means through or across. Transmembrane, something across the membrane is called transmembrane. Ultra means beyond or excess, such as ultrasound. Ultrasound, you can't hear it. Why? Because it's beyond or in excess of what my normal hearing range would be. Okay, so see, there's some common prefixes. Again, these are just a few. We'll have a lot more prefixes as the semester goes on. Okay, but these are some. We have some number prefixes, and some of these we've talked already. Die and bi both mean two. Hemi, we mentioned, means half. Mono means one. Multi means many, multiple. Okay, nully means none. Something is null means there's nothing, so nully means none. Poly also means many. Okay, polyhedron, multiple sides. Okay, well, there's a white blood cell. It's called a polymorphonuclear. Ooh, that's a long word. Polymorphonuclear, and that's one word, believe it or not. Nuclear means the nucleus. Poly means many. Morpho means shape. Okay, and AR is an adjective suffix, is at the very end. So basically, poly means many. Quad, talked about before, means four. Semi means partial, half, just like hemi. Hemi and semi mean the same. Tri means three, tricycle. Uni means one, unicycle, one. Okay, so these are some common number prefixes. So that's a little bit of idea about these word parts. Okay, and let me just sort of like go over a little summary of what we talked about making words and word structure, and what we've talked about in this video so far. What's the summary? Prefixes are at the beginning of the word. Do I need a prefix? No, but the prefix makes it much more descriptive. It's the writing and the candles on the cake. Suffixes are at the end of the word root. Do I need if I have a word root, do I need a suffix? Yes, that was rule number 1. I need a suffix at the end. I don't need a prefix, but I definitely need a suffix. You may use single or multiple word roots in creating a word, not a problem. Okay. When combining word roots, prefixes, and suffixes, a combining vowel is generally used. We talked about some rules. Again, the Lichneck rule of when to use combining vowels, how's it sound? Okay. But there are words in regard rules we have besides that we talked about before. And combining a word root and combining form, a word root and a combining vowel produces what we call a combining form. So when we see that cardi, C-A-R-D, the I is a combining vowel, put that all together, and that means that's a combining form. Okay. Gastro, G-A-S-T-R-O. Gastro means stomach. O is the combining vowel. Together, that becomes a combining form. So if I say combining form, you know what that means. Okay. So that's about that. When words are formed, generally begin with the combining form. Okay, the word root and the combining vowel. Then add what you need to complete it. So this is how we make a word. If you want to make a word, take a word root, because again, that word root is exactly where the word starts from. Okay, the basic center portion of the word. And then what you do is you can do a couple things. Number 1, I add another word root if I want. If it makes the word better, and what I want to say, add another word root. Not a problem. And I know because I have a word root, I have to also add a what? A suffix. So you're going to add a suffix to that. Then I may or may not add a prefix. That just makes it much more descriptive. So if I'm making a word, where do I start? I know I have to have a basic foundation of the word. You can't build a roof of a house without building the foundation. So I actually have that foundation. That foundation is going to be the combining form. Again, I may use a combining form with a combining vowel. I might not use that combining vowel depending upon some of the rules I had before. Okay. Okay. Again, note on some occasions the word may have no word root, may only have a prefix and suffix. I gave you a couple of those already. Okay. So that's how we make a word. That's how we make a word. But sometimes we get a word that we have to define. Okay. And what happens is we usually do this by defining the suffix first. And this sounds a little bit counterproductive. You say, well, the word root is the major center portion of the word, but that's not how we define it. We actually start with the suffix first. And then what happens is from the suffix, so let me just put this down here. Here's my word root, here's my suffix, and here's my prefix. Or let's take two word roots, word root, suffix, prefix. Okay, they're combined together. Start with the suffix. And once I define the suffix, jump to the beginning of the word, to the prefix, and then read from left to right. If I have two word roots, I'm going to still start with the suffix first, go to the prefix, then read through the word in this direction until I get to the suffix. And basically that's how I define a medical term. It's pretty simple, okay? So in other words, if I have a word that I've never seen before, start the suffix. What does that suffix say? And then go to the beginning of the word and read from left to right. And that's how we define medical terms, so we might not know what they are, okay? So that's pretty easy to figure out. Okay, so what we've talked about so far today is basically, the basic parts of a word roots, suffixes, prefixes, when I need to use them, when I might use them, and stuff like that. We talked about adding multiple word roots in there. We've talked about the different parts. We've talked to give you a little bit of idea about some of the word roots, give you a little bit of idea about some of the prefixes, a little bit of a word about the suffix, what some of those mean, and stuff like that. And that gets us to what we needed to talk about today in this particular thing. Okay, so this is just again to define the suffix first, and then go to the beginning of the word, read from left to right. Okay, and same thing here. So basically, we've talked about the rules I think you need to know, and this is the important scheme by which, I can't say all, but many medical terms we have are either made or defined. Okay, if you go through a medical dictionary, just open a page, just put your finger on something. Yeah, you're probably going to find some words that basically might be just a word itself, some special word itself that really has no other connotation. But a lot of the words, as you're reading on the page, you'll see a word root, you'll see a suffix, and you'll see a prefix. And that's how many of the medical terms we have are. I think that's really important at this point at the very beginning of the class to get this underneath your belt to understand these things. When we finally get into the second module here, we're going to talk about body parts and regional names and stuff like that. There's some specific regional names that are for things, just giving a name of something which might not follow these rules, but many of the terms that we have will follow these rules. Okay, so hopefully you've been able to follow what we've talked about here. Words start out with most words start out with a word root, and if I have a word root, I have to add a suffix. Okay, the words may have multiple word roots. We talked about how to combine those with combining vowels, when they're used, when they're not used, and then some words that will add a prefix. If I want to define a word, I start at the suffix, then go to the beginning of the word and read from left to right. Pretty easy. Okay, so hopefully this will all make sense to you. If you have any questions, you could always email me and ask me what those questions might be. And hopefully this just provides a nice foundation on which everything else in the semester that we're going to be talking about will build. Okay, I guarantee you we're going to go through many more word roots. We're going to go through many more suffixes, and the same holds true for prefixes, just a lot. Okay, and that's just one of the things. I remember a couple years ago I had a girl in a class who was a vociferous, voracious, extravagant, uh, uh, excessive flashcard maker. Okay, man, she had tons of flashcards, and when she finally came in for her final exam, she had a whole bin full of flashcards with the words she had. So I didn't ask her how many she had. I was interested in actually asking the number she had, but I never did get a chance. She was a very good student though. Okay, so anyway, hopefully these rules will make sense to you, and get these underneath your belt to start out with, because they're going to be showing up many times as the course goes on. So I'll talk to you a little bit later about both suffixes and prefixes in this first module, and we'll go from there. Okay, so see you a little bit later. Bye bye for now. Be safe, be healthy.